So in this episode of School Airway, we're going to continue talking about part 3 of ketamine. So I was warned that I had a patient in ED triage that was just assigned to me halfway across the emergency room that was refusing to come in. Alright? They're trying to drag him in, and I get a second phone call from the ED triage nurse that he walks out through the ambulance bay and has escaped. Security tells me he's staggering and he's walking out. He actually manages to walk down a city block. I see this man who's staggering, almost walking in front of incoming traffic at a stoplight. Luckily, he takes a step back. I thought my career was over. Me and security and an ED technician, we grab him, we hold him, we want to walk him over. He decides to do some passive resistance. So we wind up having to carry him up a city block into the ED. He still refuses to stay. Still stands up, staggers, almost falls. Put him back in the stretcher. Give him some ketamine, IM. 3 to 5 milligrams IM. Put some orders in. The medicine's eventually starting to kick in. I'm writing some orders in. I get warned, Dr. Torres, I did not, because I had survived the previous episode of not getting hypoventilation, hypoxia with IM. Had not told my nursing staff to put the end-tidal CO2 on. Only had pulse ox on, and found him in the 60s. When I came to the room, he was bluer than a Smurf. Like this blue. So it's an exaggeration. Not as blue as a Smurf, but this blue. Not this blue. Definitely not this blue or this blue. But blue in a normal human is never normal unless the patient's an avatar. Alright? An avatar from that Alien Race, the movie. Alright? So, had to put a face mask on him of any type. I wouldn't have cared if it was a supernova. Alright? Probably with a face mask attachment to it. Regular face mask attachment. Bagged them up. Sats up, went up to the 90s to 100s. He now is connected to the end-tidal CO2, and no more complete disassociation of the brain to the lungs. He was breathing on his own, and we kept him on the end-tidal CO2 and the pulse ox, along with other monitoring with the heart rate and BP. He, of course, later sobered up and was discharged home. This guy was such a pain in the butt. My ego hurt, my butt hurt from this case of humility. So even IM needs monitoring. Alright? So I need to be very careful in these patients who are agitated, who have intoxication. Alright? It's a dissociative that it is a sedative that can cause hypoventilation. Okay? It's very important to realize that. For myself and my staff, even with IM. Alright? The hypoxia didn't happen again. And he survived my care. Alright? Please come back for another lesson of School of Airway along with ketamine.